Hi, my name is Dr. Brian Prax. I'm a certified chiropractic sports practitioner and I practice brain-based therapy. My wife, Dr. Jennifer Prax, and I have been practicing for 15 years and have helped hundreds of people with migraine headaches. Today I'd like to talk about migraine headaches. What are the causes and what are the treatments that we provide? Like a lot of chiropractors, I've been frustrated and getting mixed results. I had a lot of patients do really well under traditional chiropractic adjustments, but some didn't get well. And it made me think, it made me wonder, what am I missing? A good friend of mine actually introduced me to Michael L. Johnson, and he's the one that created brain-based therapy, the brain-based therapy program. I'm just going to talk to you a little about Dr. Johnson. He's the author of this book that's called What Do You Do When the Medications Don't Work? A non-drug treatment of dizziness, migraine headaches, fibromyalgia, and other chronic conditions. First of all, I'd encourage you to really get this book. So go ahead and take a look at that book. Excellent. This is what describes brain-based therapy. Dr. Johnson's story. As a chiropractor for 9 solid years, he had migraine headaches, and that's what caused him to delve deeper. He actually became a chiropractic neurologist, which we'll talk about in a little bit. But he described his headaches to me as stabbing pain, almost always in the left eye. He felt like it was an ice pick going into his left eye. Always, he said, he'd get little squiggly lines that he would see. Doctors call those the prodrome. He'd see these squiggly lines, he'd get these things coming. Oh no. 20 minutes later, there's the headache. During the headache, very bad vomiting. He'd have to be in a dark room. He said, Brian, the headaches were robbing me of my life. I've got the 5 kids. Here we are at Disney World. I can't do what I want to do. Everybody's out having fun. Dad's in the hotel room suffering with migraine headaches. So as I said, he's a board-certified chiropractic neurologist. Like medical doctors, as chiropractors, we go to chiropractic college. After pre-medicine, we go to chiropractic college for 4 years, and then doctors like Dr. Johnson continue on a 3-year program and become board certified in neurology. So he's a chiropractic neurologist. Now if you want to learn more about him, again, check out his book. You can also see Dr. Johnson and how he explains the program at www.askdrjohnson.com. So, brain-based therapy, the program that he put together, what is it? First of all, what I found right from the get-go is I get way better, way more consistent results with migraine headaches. In fact, well over a 90% success rate. Let's get right into some anatomy. Let's talk about migraines and why do they happen. It's all related to the brain. Of course you can figure that because you feel it right here, right here. It's in the brain. Anyway, all pain is felt in the brain. Migraines in particular are physically actually located in the brain. It really is in your head. So the anatomy. We got the brain, we got the lower part of the brain called the cerebellum, and we got the stem of the brain called the brainstem. The brainstem has 3 parts to it. We got the upper part of the brainstem, which is called the mesencephalon. The middle part of the brainstem, which is right here, that's called the pons, and the lower brainstem, which is right at the cervical spine, called the medulla oblongata. It's really important to know the anatomy in relation to how your migraines are happening. So, next step, physiology. How does it work? How does this brain work? How do migraines occur? Well, as your body modulates and moves and does all of the things that it's supposed to do, it feeds information up to the brain. And this input up to the brain will fire impulses to the cerebrum, which processes it. The brain then will send data or stimulate information down to the medulla, and that's the brainstem. And then the medulla oblongata right here, would then inhibit or slow down the mesencephalon, the top part of the brainstem right here. Okay, so what can happen with stress, whether it's emotional, chemical, or physical, stress will decrease the firing to the brain, less input up to the brain, and a lot of times it'll do it in an imbalanced way. One side is getting more firing, more information, more input compared to the other. Alright, so if you have decreased stimulation to the brain, you will then get decreased stimulation to the medulla and the pons area, and the medulla is responsible for slowing down or inhibiting this part up here, the mesencephalon. Okay, so what does that have to do with anything? If you have an overfiring or an overstimulation to the mesencephalon, some people call it the mesencephalon, you will get dilation and constriction of blood vessels that surround the nerve mesh, and that's going to cause brain pain, and we can call that migraines or the migraine syndrome. A lot of times when people have migraines, very, very frequently they'll get light sensitivity, sensitive to light. Why is that? Well, cranial nerve 3, one of the nerves that comes off of the brain, actually comes off of the mesencephalon. It comes right out of this area right here, and that nerve, cranial nerve 3, goes to the nerve called the oculomotor nerve. It's the one that's responsible for opening and closing the pupil. Okay? And if the mesencephalon is overfiring, cranial nerve 3 overfires, the pupils become big and huge, you become sensitive to light. So that's how that works. A lot of people also with a migraine will classically get vomitings, terrible, or feel nausea. So vomiting, how does that work? Well, off of the lower part of the brainstem down here, you'll get underfiring, which would inhibit or slow down the vagus nerve, cranial nerve 10. Cranial nerve 10 comes off of the lower part of the brainstem, and the vagus nerve, also called the wanderer, travels all the way down. It controls blood pressure, but it also controls the gut. And if you have inhibition or slowing down of the vagus nerve, you're going to feel nausea and you're going to get dizziness, and then you're going to get vomiting. Okay? And some people do get dizziness, but vomiting is very common. So what do we do? Good to know that information. How can we help out? Dr. Michael L. Johnson, as I've already said, created a program called brain-based therapy. Some of the things that we can do is we want to figure out, number one, is it a brain problem? Is it that the brain is not firing as much as it could? Is it that we have an asymmetry of firing or impulses to the brain? If that's the case, then what we want to do are things that can bring into balance the brain and get that brain firing again. Here's what we do. We do unilateral adjusting, one-sided adjustments. Not the chiropractic adjustments you've experienced or you've heard. No way, those are too much. No popping, no cracking, none of those. Way too much input. We use specific gentle adjustments on one side of the body with an activator and handheld instrument that doesn't do any popping or cracking. Or sometimes we'll use the Pulsar, which provides impulses like this into the body. By stimulating these areas of the body on the side that is decreasing, it improves or increases the firing to the brain, increases the firing to the cerebellum, and then the brain stem, of course, increases, which will then decrease the firing of the mesencephalon. We can then inhibit the mesencephalon, and the migraine will go away. Okay? The other thing that we found, medical doctors have found, and we use it, is vibration therapy. You may have heard of that, but vibration therapy, vibration stimulates the brain and the cerebellum as well, does all of the same things. So we'll do that on one side compared to the other. One of the other things that we could use or try, and this works on some people really well, is olfactory stimulation. That's cranial nerve 1. And the olfactory nerve is actually the one that's breathing. So when you breathe something in on one side compared to the other, you breathe it in like this, it increases firing right to the brain, down to the brain stem, up to the mesencephalon, gets things working better. Another thing, just a couple of examples, another thing that we can use are warm calorics. Warm calorics are, a patient would sit here, we would actually drop in warm water, 60 cc's up to 360 cc's, 105 degree water, warm water into here. It stimulates the inner ear, the eardrum, which will then stimulate the brain, increase firing of the brain, and all the other stuff. So what these things can do is they're unique ways, usually one side of the body compared to the other, to stimulate the brain. Oh, another thing that works really well is exercise, which stimulates the brain, together with oxygen at the same time. The brain basically needs two things. It needs fuel, which is you get glucose from the food that you eat, and it needs to have oxygen. It has to have oxygen. The older we get, the lower our body's or brain's ability is able to utilize oxygen. So in the office we have 2 oxygen concentrators which put in up to 90% oxygen. You breathe it in through a cannula while exercising with an upper body ergometer like this. This movement here activates the brain, brings the brain up in its function, in its stimulation, while breathing in oxygen. I've seen people come in, just get on oxygen therapy while exercising, and in 5 minutes seen a migraine go away. Everybody's different, you never know, but we do whatever we can to get this brain activated and give it the fuel it needs. So, oftentimes when we do this exercise with oxygen, we'll also do that together with the vibration, usually, like I said, on one side. All this is based on the latest research. And again, I have to give Dr. Johnson the credit. Check his website out, askdrjohnson.com. This is where I get it. He's my mentor. The other thing that's really crucial that we should check, and that we do in this office, is your metabolism. Do you have an autoimmunity? Is your body attacking itself? If you do, something like rheumatoid, lupus, celiac, Hashimoto's, diabetes, that right there could be attacking the brain too. We got to check for Lyme disease. We have to check for a bunch of things, because any one of these things will affect the brain and how it's working. Do you have a food sensitivity? We have specific sensitive tests that can test for a gluten sensitivity, lactose, which is the milk, soy, egg, yeast. These are things that we must find out, because if that's what's causing the nerve system irritation, then we have to address that in addition to addressing the brain and rebuilding, literally rebuilding the brain. Okay, so I want to summarize, I want to keep it short. What makes us different? What do we do? I work with a medical doctor. He is a board-certified endocrinologist, a hormone doctor. Out of UVA, he now has an office in Scottsville, Dr. Zach Bush, who gets it, who understands brain-based therapy. He's referring his patients to me for brain-based therapy. He takes care of the metabolism in the labs, and vice versa. I refer patients to him. He takes care of the meds. The other thing that he does that I think is crucial is he'll look over all of your meds. Most people who have migraines have a whole bag full of medications. We need to get those in order. Medications themselves are affecting the nervous system as well, so we need to look at that. What else makes us different? We're not going to do any surgery. We're not going to add medications. We work towards fixing the problems. We run the labs. We run brain-based therapies based on the needs of the brain. What I'd like to do at this point is wrap it up. I'd like to close with an offer. I'd like to offer you 2 free visits. Normal value of this is over $300. We're going to run a full set of examinations. We're going to see exactly what's going on. We're going to see if you qualify. If you have a brain that's out of balance and out of function, you probably do, but let's take a look at it and see. So the first time we'll do that, we want to look at your labs. If you've had any blood labs, if you've had any MRIs or CAT scans, we want you to bring it all in. I'll look at all of those at no charge. The second time you come in, we're going to do a trial treatment. I'm going to go ahead. We might do that unilateral adjusting. We might put you on vibration, exercise with oxygen therapy. Let's see how well you do. Most people in the first visit notice a response immediately. Let's see how you do. At that point, I'll make recommendations if I think I can help you. I'm not here to waste your time. I'm not here to waste your money. If I think I can help, great. If I think I can't, I'll let you know that too, and I'll point you in the right direction, whether it's to work with Dr. Bush or whatever the case might be. So I want to invite you to come in to see if brain-based therapy can help you. I don't want to waste your time. I don't want to waste your money, but I do want to help you get better, and I'm confident I can help you out. So please help me help you, and help me to help others. If you were the one who requested this DVD, if you requested it for yourself, pick up the phone and give us a call. Okay? We're going to offer you the 2 free visits. You can't lose. You might lose it. You might lose your migraines, but you can't lose on them. I'm not charging you anything. Okay? Our number is 434-977-5433. All right? Please stop letting migraines rob you from your health, really rob you from your life. Imagine, if you will, a life free of migraines. No more dark rooms on a sunny day. No more vomiting. No more missing out on those outings with the kids or missing another day of work. Please, just pick up the phone. Give me a call. Even if you have any questions, you want to talk to me more thoroughly, call me. I'm here for you. I want to help you out. Again, the number is 977-5433. If you'd like, you can look me up. My name is Dr. Brian Prax, P like Peter, R-A-X. Our website is chiroprax.com. Take a look at it, see what you think. Right after this, I've actually attached some testimonials for you. These are real live patients who were skeptical, like most of our new patients, maybe like you, I understand. Get a lot of skeptical people, and that's why we offer the 2 free visits. Give it a try. So go ahead and listen to their stories. Give me a call. I can help you. I look forward to meeting you real soon.